My name is Andy Brokenbrough. I'm a nephrologist, and for a short person like myself with a Napoleon complex, it's really a treat to be standing at this podium surrounded by 4 oversized projections of myself. Nancy is an inspiration to all of us, particularly the physicians, and we're grateful for all of the time she's volunteered with the Kidney Center as well as around the country. And so I just want to acknowledge her contributions with a round of applause. So it's stories like Nancy that remind me that I have the best job on earth. As a nephrologist, I take care of people with kidney problems. And as many of you know, I take my job very seriously, not only professionally, but also personally. So much so that I convinced my wife to name my eldest daughter Sydney because it rhymes with kidney. My second daughter is Jean, which rhymes with bean. So my daughters are Sydney, Jean, Kidney Bean. I have a son as well, whose name is Chase, which rhymes with acid base, an important kidney function. And a year ago, when Chase was 9 years old, he broke his arm for the 3rd time. And for the 2nd time, he had to go to the operating room, and we ended up staying up overnight in the hospital. In retrospect, it was a pretty good deal for him because he had a nephrologist sitting at his bedside all night long waiting to help. And that moment came at 3 o'clock in the morning. I remember him lying in bed, helpless, his right arm in a cast, his left arm immobilized by an IV. And he woke and said with a meager whimper, "Dad, I can't pee." Now, the promotion of urine production is something I do professionally. And I remember thinking to myself that all my years of training had prepared me for this one particular moment. But what I'll remember for the rest of my life is the wonderful feeling of being there for my son in his time of need. It's one thing to be there for people when they're doing well, but to be there for them when they really need help is a privilege. It's a privilege that's taught me many lessons in life, how to be a better physician, a better father, a better person, and I was asked to share with you all some of the lessons I've learned from my patients. The first lesson I'll share is one that I'm reminded of on a daily basis by my patients. It's the difference between needs and wants. One of my hemodialysis patients passed away 2 months ago. His name was John, and he had almost nothing. He lost his left arm in a motorcycle accident years ago. In the last 6 months of life, he lost his right hand and his right leg because of poor blood supply. He lost his ability to walk. He lost his independence. He lost his apartment and his possessions. And he lost his privacy when he had to move into a nursing home to manage his wounds and chronic pain. He was admitted to the hospital on several occasions, and every time I was asked by a different provider to please talk to him about the possibility of stopping dialysis. After all, he had chronic wounds and chronic pain and chronic anxiety, and therefore the quality of his life must be very poor. This is a difficult conversation to have with a dialysis patient. I remember sitting down with him and asking him how he was doing and asking him what his goals were and asking him, is there anything in life that you look forward to or enjoy? And with the last question, he smiled. He said, "Oh yeah, my sister. My sister sometimes does my laundry, and I love it when she does my laundry, and my dad sometimes visits me on dialysis." These were the 2 things that he looked forward to in life. He was proud of his sister and his dad and their love for him. This was his need, to feel loved and cared for by his family. Everything else in life, from his physical health to his independence and privacy, were all just wants. And in the end, John had almost nothing, and yet his life was still very meaningful to him. Sometimes the silver lining of loss is that it reminds us of what we have. Now, losing John was very hard for his family, particularly his father, and as a parent myself, I've learned over the years that all parents want the same thing for our kids, regardless of our background. We want our kids to be happy. We want them to be healthy and safe. We want them to work hard and make this world a better place. And we teach them to set high expectations for themselves. I'm reminded of this every month when I see one of my peritoneal dialysis patients named Dell. Dell is a former dancer, and when she was young, she studied with a British dance instructor whose highest form of praise was, "That was nearly very good." Always nudging her students towards improvement. And when I first started to work with Dell, I remember sitting down with her and telling her what a great job she was doing. Her blood pressure was perfect and her labs were amazing. And I'll never forget how disappointed she looked. And so I asked her what was wrong. And she shared with me the philosophy of her British dance instructor and how the phrase "nearly very good" always inspired her to try harder. And then she told me that's what she wanted from me as a physician. Even though she was doing well, she wanted someone to encourage her to do even better. So now when I see her every month, I tell her that her labs and her blood pressure are nearly very good. And she smiles, and it reminds me to encourage her, as well as all of my patients and myself and my family and friends, to set high expectations for ourselves, because we can always do better. Now, doing better is easier if you have support, and dialysis patients need a lot of support. It comes from family and friends. It comes from the many layers of this organization, from the dialysis technicians, to the nurses, to the care managers, the social workers, the dietitians, the financial advocates, and the pharmacy. And by its very existence, the Northwest Kidney Center brings patients together. They interact with each other during dialysis, and they interact with each other before and after dialysis in the waiting room. And I've learned over the years that dialysis patients really listen to each other, because if you've been through dialysis, you know what the other person is going through. I have a home hemodialysis patient named Bill. Bill's in his mid-40s, has 5 children, and previously dialyzed at the Auburn unit of the Northwest Kidney Center before switching to home dialysis. And last year, Bill's second oldest son went off to college, where he befriended a classmate whose dad had just started dialysis. And when Bill heard this, that the father of his son's best friend in college had just started dialysis, he felt motivated to find that person, whose name is Elias, and see if there's anything he could do to help him. Bill found Elias dialyzing at the Auburn unit of the Northwest Kidney Center in the exact same chair and time slot that Bill used to occupy. A real-life coincidence typically only seen in novels by Charles Dickens. And when Bill found Elias, he started visiting him, and he's visited him anywhere from 1 to 3 times per week over the last year to provide guidance, support, and friendship. So you have the 2 sons taking care of each other at the University of Washington, and the 2 dads looking at each other at the Auburn unit of the Northwest Kidney Center. I think we live in a beautiful world. Dialysis patients aren't the only ones who need support. Their families need support too, because they also go through dialysis, and sometimes that support comes from unexpected places. I have a kidney transplant patient named Ty, and 5 years ago, he, his wife, and 2 young daughters went through difficult times, both financially and emotionally, when Ty lost his kidney function, had to start dialysis, and lost his job at the same time. Now, his oldest daughter was 6 at that time, and she was old enough to worry about her dad, and that constant worrying interfered with her behavior, particularly in school. 4 years later, she was 10, and her dad received a kidney transplant, and there were some initial complications, and this little girl worried more and acted out more. And then a small miracle happened. She entered 5th grade, and she was assigned to a teacher whose husband had just received a kidney transplant at the same time as her father. And that teacher recognized that she was in a very special position to help this little girl. And so she sat her down, and they talked about transplantation, they talked about life in general. And over the course of that year, that teacher helped shape that little girl into the well-adjusted, excellent student she is today. Now, it may have been chance, or perhaps providence, that that little girl was assigned to that particular teacher at a time when she needed help the most. In either case, there are angels among us who help us get by in this world. And these angels are motivated by love, which brings me to my final story this morning. I once had a peritoneal dialysis patient named Michelle, who was fiercely independent until she lost both legs and had a number of other health problems. and she lost the ability to take care of herself. At the time, she had a 21-year-old daughter named Mary Ruth, and Mary Ruth had her own problems. She was born with congenital heart disease and undergone 3 open heart surgeries, including one as a young adult. And Mary Ruth had just graduated from college, and she had dreams of going on to law school. But when her mother became sick, she postponed that dream and instead became her mother's full-time caregiver for the next 5 years. Mary Ruth did everything for Mother, from peritoneal dialysis to personal hygiene, and she helped her mother live and ultimately die with dignity. Now, Mary Ruth was an exceptional caregiver, not so much because she's bright and hardworking. The main reason she was so exceptional was because of love for her mother. There is no greater motivator in this world. And after her mother passed away, Mary Ruth went on to law school, and she graduated last summer, and we still keep in touch, and I know she will be successful because she's learned an incredibly important lesson in life: how to put someone else's life before your own and how to serve others. And that is what the Northwest Kidney Center is all about: service and love to those who have kidney disease. I'm grateful to the Northwest Kidney Center for the care it provides my patients, and I'm grateful to your support because it makes that care possible. The Northwest Kidney Center provides a service that a former British dance instructor would describe as nearly very good. Excellent care, but never fully satisfied, always trying to improve, always wanting to do more for patients with kidney disease, their families, and our community. Thank you for your support.